Hi, my name is Dr. Siegfried, and today we're going to be giving David Jones a nasal specific treatment. David is an interesting case. He was born with cerebral palsy, and his parents were told that there wasn't anything that could be done for him. And his mother was fortunate enough to find Dr. Stober, who was the developer of the nasal specific technique in the Northwest. And David had treatments with Dr. Stober for quite some time, and it was just a progression of improvement from the day he started. And then I think he was, what were you, 8 or 9, and you moved away?
Yes.
When he was 8 or 9 years old, his family moved and out of Portland, so he didn't have any more treatments. And the treatments that he did have helped tremendously, made him a lot more functional. And then they moved, and then you came back to this area how many years later?
10 years later.
How many?
10 years later.
So he moved back to this area around 10 years later, and then still didn't have any treatments, and it came in his brain that he'd had some before, and he thought maybe this would help him if he could get some more. So he was looking and ended up finding me, and so I've been taking care of David for several years now, off and on. When he needs, he kind of knows when he needs to get treatment, because when his, for example, you said like your balance is off, or
Balance is off, and there's tightening on the right side of my body.
yeah. So those are his indicators for him that he's in need of a nasal specific treatment. So we'll give him 1 or 2 or whatever, and off he'll go until the next time. And so I'm going to be demonstrating today what I'm going to be doing, the treatment that I give to David. And the first thing is I have the bulb here, what we call it. It's a blood pressure bulb, and I've got an inner tube and what we call 2-ply, which is 2 finger cots on top of the inner tube. And then what I do is I take a little bit of KY jelly and lubricate the finger cot so it passes, so I can insert it into the passageways more comfortably for the patient. And then we get started. So what we'll do is, and I always make sure that the patient has some tissue here, because sometimes there's drainage depending on different things. Sometimes there's drainage, and that way he can blow his nose. So the procedure that I have, the way we do it is this: I have David blow out his nose, and then I'll insert the finger cots, and then he'll take a deep breath in, and then I inflate it until I get the release. And we'll do the bottom pair each side, middle pair on each side, top pair on each side, and the bottom pair again to make sure everything's set properly. So with that, let's just get started here. So you blow out your nose. That. Take a deep breath in. Hold it right there. Good. Now, the other thing that's interesting is, depending upon how long it's been from one treatment to the next, sometimes the head will be a little bit tight. That's the way we refer to it. And as it stands today, it's tight because he hasn't had a treatment for quite a while. And that's the first. So that's the first bottom floor inflation. So blow out your nose, and we go to the second, the bottom floor on the right. Take a breath in. Good. So that's the first floor. And then we go to the second floor. Blow out your nose. Take a breath in. Good. And we can go as fast or as slow. I usually after doing this for so many years, I just let the patients dictate. Some people can go faster than others. So whenever you're ready, blow out. Breath in. Good. It's not uncommon for one side of the head to be looser than the other, and therefore there's less resistance. However, we do get the movement. Blow out your nose. Take a breath in. Good. Now in his case, the left side's a little bit tighter. And there's all kinds of reasons for that relative to from his birth process all the way on. Blow out your nose. Take a breath in. Good. Third floor. Now we go to the bottom floor. Again, blow out your nose. Take a breath in. Good. Ready? Blow out your nose. Take a breath in. Good. Now that moved good. You can tell, right?
Yes.
So that's the basic treatment. That's the basic nasal specific treatment that we provide for David each time I see him. In terms of the frequency, in his case right now, it's basically a maintenance program to try to keep him going. And again, he told us when he knows he needs to get an adjustment. So that's how we do it for him. And you can go ahead and sit right up. And as you can see, you're done, you sit up, and he's ready to go. So do you have anything that you'd like to add, David?
No, not this time. It helped release the stress that was on my head, and I was quite tight on the right side of my body, and when we went into the center cavity, it unlocked a lot of that, and I felt a lot of stress relief, and so I'm really grateful.
Yeah, the thing is, when we talk about the release, basically what we're talking about is the sphenoid bone, which is the base of the skull, is where the adjustment is made. And as that is adjusted, then the rest of the skull follows suit. And so when patients say they can feel that release, that's what's happening. It's the sphenoid bone in the skull that's being adjusted and freed up. So anything else?
That's it.
Okay, good. Thanks for watching, and have a good day.